hiphousechat.com.
Visit CaliforniaClosets.com to set up a free design consultation.
If you were watching this morning and have ever tried to get in to see a mental health provider, no doubt you realize that sometimes that can be easier said than done. This is Kristen Smith, and she is very happy to be here talking about Parkridge Hospital's newest mental health therapy center, newly opened Christmas week, right?
Yes, that's correct.
Over in East Ridge. So thanks for being here.
Sure, thank you for having me.
I think I'm right in what I said, that it can be a real challenge when you need to find a therapist, to find one who has availability.
Sure.
You do. You have immediate openings.
We have immediate openings for both in-person and then also virtual care as long as you reside in the state of Tennessee.
Virtual care,
Virtual.
that's very important because sometimes just the ability to free up time in your day is impossible.
Yes. We want to accommodate Chattanoogan's and our surrounding communities that have busy schedules.
So one thing I want to point out too that I think is a little bit different, many people who have sought mental health care in the past are very accustomed to the self-pay principle.
Sure.
You are actually going to be billing their insurance companies for them.
Yes,
is that right?
We accept all major insurances, including TennCare and Medicare, and so we will bill the insurance first. I know a lot of practices in our area, you know, they prefer that you self-pay, and then you sort of have to go through the billing yourself. So we're going to take care of that for the patient.
I think that's a really great thing because sometimes that's an immediate obstacle for
It is.
people.
Yes.
So let's talk about breaking those obstacles down a little bit. You also see families, if you will, 12 and up.
We do.
So does that mean that within, and I know you're still bringing new providers into the practice, but if you're, let's say it's a mom who's gone through a divorce and she's concerned about her kids, but also herself.
Sure.
There'll be someone who can help everybody?
Yes, so we can see them individually, we could see the children, and we could see mom, or we could see them all as a family system.
With the telehealth part of it, the virtual appointments, is that ever a little bit tricky because you do want to protect the privacy? So if it's a child's visit, what access does the parent have in that conversation?
Sure, I think that it's always a little bit tricky with the virtual, but we would treat it sort of the same as we would in person. You know, we would let the child know that the things that they're saying to us stay with us outside of certain statements they make, and then just keep the parent, you know, involved as we possibly can.
How important is it when you're looking for a mental health provider to find one with the certifications, if you will, that really meet your need?
I think it's very important. It's difficult sometimes for a lot of people to find a therapist that they really match with, that they feel comfortable with, that they want to continue seeing. That can be difficult. Just in general, accessing mental health care is sometimes difficult for some of us. You know, I know that if you look at it as compared to physical health, we don't really treat it the same way. You know, I would go into an ER or see someone for chest pain, but I may not go and want to talk to someone about my anxiety about work.
Right.
So we hope to kind of break that down and make that easier for them by offering, you know, different therapists with different backgrounds and expertise.
So, I mean, the fact that you're part of the Parkridge system, I'm guessing means that then you can kind of cross-refer.
Okay, yes.
So I'll let you elaborate on that a little bit, but you nodded pretty quickly. So if somebody comes to you and you use the chest pain example, maybe there's a physical component there as well.
Right, and there is a physical component, I think, with a lot of mental health issues. So yes, we are part of the Parkridge Health System, so they would have access to the full continuum of services within all of our Parkridge facilities and programs.
It feels like more and more conversations occur now about people's mental health, and yet I'm guessing that not as many people seek the care as would benefit from it.
That's correct. I think we absolutely have more resources than we did, say, in 2020. But in 2022, according to the National Association of Mental Illness, 23% of adult Americans had a mental health disorder, but only half of those actually sought the care. I think we're used to just sort of powering through feelings of sadness, grief, anxiety, things like that on a daily basis as humans, instead of sort of treating that like you would, you know, a physical ailment.
Okay, I'm going to step out on a limb here.
Sure.
But when you said 23% of adults would be considered to have a mental health disorder, I would have thought the number would have been a lot higher.
Well, that's with an actual diagnosis. That's not just experiencing mental health symptoms.
Okay.
They have been diagnosed.
Okay. The limb I was about to step out on, so it might just break underneath me. Forgive if it does. But it feels sometimes like that umbrella gets so wide, that net gets cast so far, that there are some people who may have a bit of a struggle, and then there are people who really need it. And have we almost done a disservice in I don't know how I'm trying to get to my point, but that there are people who really, really struggle and they need to be taken seriously.
Yes, sure. I think that the continuum for mental health symptoms and diagnoses is absolutely as wide as you reference.
Yeah.
But I think that's kind of been the historical issue, is that we do get help to the people that really, really struggle. But those of us that are sort of in the middle or just moderately struggling, we may not, see the need to reach out and get help for ourselves,
Right.
because we aren't having those terrible struggles.
Well, and then does it build? So if you're
It
in that
does.
moderate level
It
and you
does.
can get that help,
It does.
doesn't progress forward.
That's correct. And that's one of the goals of the Mental Health Therapy Center, is we want you to reach out and get help at that level of care, which is just the outpatient level of care, before symptoms worsen.
Right.
And you have to be, in a different situation.
Well, I think that 3 buzzwords are that you're newly opened and you have immediate openings. The fact that you're going to file the insurance for people, I think, is huge. And then having the ability to do virtual just makes it completely user-friendly.
Yes.
So
That's the
here's where
goal.
you will find them, okay? It's the new Parkridge Mental Health Therapy Center, newly opened on Spring Creek Road. The exact location is 961 Spring Creek, right behind the hospital. Their suite 202, and the phone number is 680-5595. Call them. You'll get a real person answering the phone, and they'll be happy to set you up with an appointment. Thank you.
Thank you.
Wholesale Supply is your one-stop shop